Vitamin C is absolutely essential for brain health, blood flow, and immunity. Vitamin C is the most effective antioxidant in your blood due to its water solubility and the wide range of radical oxygen species that it can scavenge. Vitamin C is an essential water-soluble micronutrient that's had a dramatic influence on world history. Naval and sea battles have literally been won and lost based on the numbers of the naval forces sick with scurvy, which is a severe vitamin C deficiency. Early research suggests that it's great for a whole range of health issues like high blood pressure, strokes, cancer, atherosclerosis, inflammation, and obesity. Vitamin C is an essential water-soluble vitamin with powerful antioxidant properties. Vitamin C has many benefits, such as it helps and prevents colds and flu when the body's stressed. It's very safe. A lot of people find high-dose vitamin C very good for immunodeficiency, chronic toxin, or infectious problems. It has antioxidant and anti-inflammatory effects. It's good for mood. It supports skin and bone health. It's good for a wide array of conditions, including histamine intolerance, and high doses have been researched for anti-cancer effects. Vitamin C is an essential nutrient and antioxidant with a number of important functions in the body, and as such, vitamin C deficiency can produce serious symptoms. Vitamin C is extremely important as an antioxidant owing to its ability to neutralize oxygen and nitrogen-based radicals, and because it also recycles both vitamin E and BH4, which is tetrahydrobiopterin, and these have key antioxidant and enzyme cofactor functions. Vitamin C contributes to many important enzyme reactions, including those leading to the synthesis of norepinephrine, carnitine, cholesterol, amino acids, and several peptide hormones. Because of its structure similar to glucose, vitamin C can replace glucose in many chemical reactions, and it can prevent the non-enzymatic glycylation of proteins. Vitamin C is important for general well-being since it can neutralize free radicals and support methylation. As proof of the importance of vitamin C for brain health, the brain retains vitamin C at the expense of other tissues during chronic stress such as deficiency, and it can uphold concentrations 100 times higher than other organs like the liver and the kidney. Vitamin C plays a role in many important functions in the brain, including reactive oxygen species scavenging, neuromodulation, and the development of new blood vessels, or angiogenesis. Vitamin C modulates neurotransmitter symptoms of the brain, such as cholinergic, catecholaminergic, and glutaminergic. Vitamin C helps in the general development of neurons through maturation, differentiation, and myelin formation. Vitamin C helps to maintain the integrity and the function of several processes in the vascular system, which helps brain function. Vitamin C participates in neuronal maturation and myelin formation, which is the electrically insulating layer around the nerves, and is also involved in transmitting signals throughout the nervous system via neurotransmitters. Vitamin C can also prevent neuronal damage. Vitamin C induces the expression of brain-derived neurotrophic factor BDNF, contributing to the defense mechanisms of the brain. Adequate vitamin C levels likely support cognition, myelination, neurotransmitter balance, and overall brain health. Vitamin C stimulates mitochondrial function by decreasing reactive oxygen species, stimulating the activity of manganese superoxide dismutase, SOD2, and glutathione peroxidase, and modifying the activity of the electron transport chain. Vitamin C protects the mitochondrial membranes and DNA against oxidative damage. Stabilization of collagen by vitamin C is critical to forming the connective tissue framework of the entire body, including the skin, bones, cartilage, tendons, ligaments, and blood vessels. The final steps of collagen production depend on vitamin C. Vitamin C acts as an electron donor in the hydroxylation of procollagen, propyl, and lysyl residues. Vitamin C deficiency disrupts collagen maturation, leading to impaired integrity of the blood vessel wall, hemorrhage, and cerebral bleeding in mice. Vitamin C reduces oxidative stress in the mitochondria, and is also needed for collagen production in the body. Vitamin C is essential for normal bone development. In humans, there's a positive relationship between vitamin C levels and bone health, indicated by bone mineral density, fracture probability, and bone turnover markers. Vitamin C deficient animals show impaired bone health and decreased bone formation. Vitamin C supplementation was able to prevent bone loss in several animal models. A vitamin C deficiency plays an important role in spontaneous bone fracture by inhibiting bone cell differentiation and by promoting the transition of bone cells into fat cells in mice. Daily use of vitamin C supplements, along with estrogen replacement therapy and calcium supplements, can help to increase bone mass in postmenopausal women. Higher vitamin C intakes were associated with a lower risk of osteoporosis in Korean adults aged over 50 with low levels of physical activity. In addition to stabilizing collagen in the bone matrix, vitamin C also scavenges free radicals, which are detrimental to bone health. Vitamin C contributes to the maintenance of healthy skin. Applied to the skin, topical vitamin C is highly efficient as a rejuvenation therapy, inducing significant collagen synthesis with minimal side effects. Topical vitamin C can partially correct structural changes that are associated with the aging process. Vitamin C is an effective short-term treatment for melasma and post-inflammatory hyperpigmentation. Adequate vitamin C intake is essential for bone and skin health. A deficiency has been associated with brittle bones and skin aging. Vitamin C enhances the bioavailability of other nutrients like vitamin E and non-heme iron, and this may enhance the health effects of vitamin C containing foods. Vitamin C levels in the lungs are up to 30 times higher than in the blood. Vitamin C gets consumed while it protects against oxidants, indicating that even a single dose of vitamin C can be effective in protecting against acute increases in oxidative stress in the lungs. Vitamin C likely supports lung health and improves the bioavailability of other important nutrients like iron and vitamin E. Vitamin C deficiency or scurvy presents with symptoms such as lethargy, anorexia, fatigue, weakness, and rash. As scurvy progresses, it may cause anemia, pain, easy bruising, gum disease, poor wound healing, and depression. Vitamin C supplementation, as supervised by a medical professional, easily and effectively reverses scurvy. Likewise, a diet high in vitamin C or vitamin C supplementation will prevent the development of scurvy. Based on existing evidence, it's possible that getting enough vitamin C also supports a healthy mood. Long-term vitamin C deprivation is linked to nervousness and emotional instability. Vitamin C increases oxytocin release. There was a 35% reduction in mood disturbance in hospital patients following a treatment with vitamin C. Another study found that vitamin C supplementation does not have large effects on psychological performance, personality, or current mental state in young men aged 17 to 29, except in cases where the supplementation corrects an existing deficiency. Vitamin C reduced anxiety in high school students. Short-term supplementation of vitamin C was safe and beneficial for reducing the anxiety levels also in diabetic patients. Many studies have found that vitamin C may reduce the severity of depressive disorders in both children and adults, as well as improve the mood of healthy individuals. In a trial including depressed shift workers, vitamin C significantly decreased depression severity. Poor vitamin C status is associated with increased symptoms of depression following an acute illness in older people. Adequate vitamin C levels are necessary for the conversion of the neurotransmitter dopamine to norepinephrine, an important hormone in depression and mood swings. According to some researchers, this may explain why patients with vitamin C deficiency present with symptoms of depression. Vitamin C also increases the effectiveness of antidepressants. Patients treated for 6 months with fluoxetine or Prozac and vitamin C showed a significant decrease in depressive symptoms when compared to the fluoxetine plus the placebo group. Vitamin C deficient mice are also less active. Chronic low vitamin C status in humans is associated with neurodegenerative disorders. However, no causal link has yet been established. Higher vitamin C intake has been associated with better cognitive function in the elderly. Vitamin C levels were significantly lower in elderly people suffering from different kinds of dementia. Supplementation with vitamin C was associated with a reduced incidence of Alzheimer's disease in humans. Vitamin C injected for 3 consecutive days improved the learning and memory of aged mice. In rodents, vitamin C treatments countered the impaired memory caused by chronic sleep deprivation. In animal models of Alzheimer's disease, vitamin C improved cognitive performance. However, in the aging brain, vitamin C deficiency may impair cognitive function through reduced signal transduction as well as amyloid beta deposits, resulting in the generation of reactive oxygen species and an increased risk of Alzheimer's disease. Many infections lead to reduced vitamin C levels. However, whether or not vitamin C can prevent or reduce the severity of infections, including a common cold, is still a controversial topic. Although some studies have had mixed results, the majority of evidence backs up the benefits of supplementation. Vitamin C increases the functioning of various white blood cell types, and it decreases the replication of viruses. Vitamin C reduced the duration and the severity of the common cold. It reduced the incidence of colds at times of extreme physical stress. Vitamin C reduced the incidence of pneumonia, and vitamin C decreased the duration and severity of respiratory infections in male swimmers, but not in women. Supplementary vitamin C promoted Helicobacter pylori eradication in 30% of patients who were receiving the supplement in addition to their conventional therapy. Vitamin C may reduce inflammation by inhibiting inflammatory cytokines. It alleviated inflammation in patients with obesity, diabetes, and high blood pressure. High-dose intravenous vitamin C may reduce inflammation in cancer patients. Vitamin C may inhibit obesity-related inflammation and therefore prevent obesity-related inflammatory diseases. Vitamin C reduced oxidative stress and inflammatory response to artificially induced inflammatory bowel disease, or IBD, and it reduced cytokines, MPO and MDA activities. Vitamin C increased physical performance and decreased oxidative stress, but only in those with already low vitamin C status. Vitamin C decreased the level of free radicals generated during exercise, and it attenuates oxidative stress. Vitamin C prevented exercise-induced muscle damage, immune dysfunction, and fatigue. However, it's important to note the reactive oxygen species may actually control beneficial training adaptation that the high dose of vitamin C could prevent from occurring. As vitamin C levels decrease, blood histamine levels tend to increase. Oral and intravenous administration of vitamin C resulted in a reduction of blood histamine levels. Histamine is a potential causative agent of seasickness. People exposed to waves show increases in histamine levels. Vitamin C is effective in suppressing symptoms of seasickness, particularly in younger individuals. Vitamin C is associated with higher levels of progesterone and follicle-stimulating hormone in healthy premenopausal women. Some studies found that babies weighed more when they and their mothers had higher blood vitamin C levels. In the developing brain of a baby, neuronal density and maturation are compromised by a vitamin C deficiency, giving rise to decreased brain volume. An absence of vitamin C is detrimental to survival in newborn mice. Furthermore, deficiency around birth reduced hippocampal volume and neuronal number and caused decreased spatial cognition in guinea pigs. In one study, high-dose vitamin C improved mood and it increased intercourse frequency in 42 healthy adults. And for sperm quality, vitamin C improved sperm motility and structure in men. The administration of high-dose intravenous vitamin C reduced fatigue in office workers. Vitamin C also delays fatigue in rats. Vitamin C significantly lowered systolic and diastolic blood pressure in patients with mild to moderate high blood pressure. High-dose vitamin C can prevent or restore impaired blood flow caused by reactive oxygen species. It can preserve the integrity of the blood vessel barrier, and it can strengthen antibacterial defenses. Vitamin C helps to prevent blood vessel dysfunction, stimulate collagen synthesis, and enhance cell proliferation of blood vessel cells. Vitamin C plays a positive role in reversing the earliest stages of hardening of the arteries. Vitamin C deficiency may result in decreased blood vessel integrity through decreased nitric oxide generation and impaired synthesis of mature collagen. This might lead to increased plaque formation and the incidence of a stroke. Vitamin C may improve gut tolerability to aspirin and other non-steroidal anti-inflammatory drugs. Vitamin C saves mice from irradiation-induced gut damage that is usually lethal. People with adequate levels of vitamin C burn 30% more fat during moderate exercise when compared to subjects with lower vitamin C levels. Vitamin C inhibits the fat accumulation of fat cells. Vitamin D supplementation has been associated with body weight reduction and a massive reduction in the number of fat cells in rats and guinea pigs. 8 weeks of vitamin C supplementation in a cafeteria model of obesity protected rats against diet-induced fat storage and excess leptin. Low vitamin C levels are related to high waist-to-hip ratio. Vitamin C has been associated with a lower prevalence of obesity and with the prevention of weight gain in a 3-year follow-up study in adults. Vitamin C administration improved whole-body glucose disposal and non-oxidative glucose metabolism. Reduction in glucose and insulin levels were much better in rats that were fed a high-fat diet, supplemented with vitamin C for 2 weeks, when compared to those fed high-fat alone. Vitamin C protects against diabetic blindness. It improves high-density lipoprotein cholesterol, or HDLC, and it improves blood vessel function. Vitamin C may benefit patients with type 2 diabetes by decreasing blood glucose and lipids. Vitamin C inhibits the production of cortisol, glucocorticoids, which raise blood sugar. Brain vitamin C concentrations increase during ischemia due to inadequate blood supply. In rodents and primates, vitamin C reduced the area of the brain deprived of blood supply during a stroke. In humans, high vitamin C levels were associated with a lower likelihood of a stroke. People who smoke have lower levels of blood and cellular vitamin C and also vitamin E. Vitamin C supplements of 500 milligrams twice per day for 2 weeks were sufficient to normalize the disappearance rate of the vitamin E in smokers. Vitamin C reduces the amount of persistent organic pollutants in 15 adult women. Blood vitamin C concentrations fall after surgery and a further decline in patients under surgical intensive care due to an increased demand caused by increased oxidative stress. In uncomplicated gastrointestinal surgery, continuous administration of vitamin C reduced post-operative oxidative stress. Post-operative atrial fibrillation or abnormal heart rhythm was prevented after cardiac surgery by vitamin C supplementation. In rats, low doses of vitamin C stimulate the thyroid, whereas high doses inhibit thyroid activity. Vitamin C inhibits the production of cortisol and glucocorticoids in guinea pigs, indicating that there's a potential role in suppressing the stress response. Reports suggest that high doses of vitamin C have anti-cancer effects in lab settings. High-dose vitamin C is more toxic to cancer than it is to normal cells, and it induces the death of various types of cancer cells, including mesothelioma, pancreatic, and leukemia cells. High-dose vitamin C suppresses tumor growth in animal models and tissue culture studies. High dietary vitamin C has been linked to a reduced incidence of gastric cancer. Higher dietary vitamin C intake before breast cancer diagnosis was linked to increased survival rates. This association was strongest among women over the age of 65. In one study, men with low vitamin C levels were 62% more likely to die from cancer. Vitamin C lowers pain, and it reduces the toxicity of some anti-cancer agents by reducing oxidative stress. Intravenous vitamin C alleviates a number of cancer and chemotherapy-related symptoms, such as fatigue, insomnia, loss of appetite, nausea, and pain. Vitamin C can reduce pain by 55% in radiotherapy patients with bone cancer. Vitamin C can improve the quality of life of cancer patients, including reduced pain and the need for painkillers, both in the presence and the absence of chemo and radiotherapy. The current recommended daily intake for vitamin C is 75 mg a day for women and 90 mg a day for men. Amounts up to 125 mg per day are recommended for pregnant or lactating women, and an additional 35 mg per day to account for increased oxidative stress and vitamin C turnover in smokers. Most animals can produce vitamin C from glucose in the liver. However, humans have lost this ability, and so an adequate, regular dietary intake is therefore essential. Vitamin C is needed in relatively high quantities since it's not retained nor accumulated in the body, and the excess is immediately eliminated through the urine. The recommended daily allowance for a given nutrient is calculated based on avoiding a deficiency. Several sources now suggest that the RDA should be as much as double the currently advised 75 to 125 mg per day. At vitamin C intakes above 60 mg per day, vitamin C begins to appear in the urine. However, intakes of 250 mg per day and higher, approximately 400 mg per day, are required to saturate vitamin C concentrations in the blood and the white blood cells. The vitamin C recommended daily allowance for adult men is 90 mg and for women 75 mg, but requirements can go up depending on age, gender, pregnancy, and smoking habits. The tolerable upper intake level is stated to be 2 grams per day for adults. However, many people receive more than that in clinical settings without suffering from apparent side effects. Patients with pneumonia have received up to 100 grams per day of vitamin C without developing diarrhea because of the changes in vitamin C metabolism that are caused by the infection. Liposomal non-acidic vitamin C forms can be taken in higher doses without any gastrointestinal upset occurring. You can see my video on how to make liposomal vitamin C for more information about this. When the daily dose of ascorbic acid was increased from 200 to 2,500 milligrams, the blood concentration only increased from approximately 12 to 15 milligrams per litre. This is due to the kidney clearance. Hence, This is why some state that there's no justification for megadoses of vitamin C in healthy individuals. This is unless you're using a highly absorbable form, like a non-acidic liposomal vitamin C. Although higher doses have been administered in controlled research settings, 2 grams a day of vitamin C is set as the upper tolerable intake level for the cheap ascorbic acid form. Most comparative bioavailability studies in humans have shown no difference between synthetic and natural vitamin C, regardless of the subject population, the study design, or the intervention used. However, bioflavonoids like quercetin can increase the absorption of vitamin C, and these are naturally found in certain fruits that also contain vitamin C. It's important to note the reactive oxygen species may actually control beneficial training adaptations that high doses of vitamin C prevent from occurring. Supplemental intakes greater than 500 milligrams per day may cause kidney stones in those that are prone to them. However, vitamin K2 and vitamin D supplementation can help to prevent calcium buildup in the body. Vitamin C can enhance iron absorption by maintaining iron in the ferrous form rather than the ferric state. This is beneficial in some patients, such as those with gut issues when low ferritin levels, but not in those that suffer from medical conditions that cause an iron overload. High intake of vitamin C exerts a pro-oxidant effect by its interaction with metal ions via a number of established RONS generating systems. Caution should be exerted regarding surplus vitamin C intake for patients with chronic inflammatory disease or atherosclerosis. Some research has found that combining high-dose vitamin C and vitamin E supplementation can be harmful, even though the harm may be restricted to the selected group of smokers. Vitamin C intake might be responsible for high serum uric acid levels based on a study in Korean rural communities. Higher uric acid can be a good thing, such as improving productivity and intelligence, but it can cause problems if you're prone to kidney stones or gout. High vitamin C intake from supplements was associated with an increased risk of cardiovascular disease mortality in postmenopausal women who had diabetes. Vitamin C is an essential nutrient, meaning that we need to get sufficient amounts from a diet to be healthy to prevent deficiency. Since vitamin C is water-soluble, it isn't stored in large amounts in the body. Getting adequate amounts of vitamin C supports brain, bone, skin, and lung health. Dietary vitamin C also boosts the bioavailability of vitamin E and plant-based iron. There's countless purported benefits of vitamin C supplementation, but only some are supported by decent evidence. Supplementing is efficient for scurvy, which is a severe form of vitamin C deficiency. Supplements may also help prevent age-related macular degeneration and the common cold. The upper tolerable intake is 2 grams per day. Taking more than this could be considered to be unsafe or pointless. The recommended daily allowance is 75 milligrams for women and 90 milligrams for men. Most supplements contain 100 to 500 milligrams of vitamin C. Liposomal vitamin C will allow for higher doses, especially in demanding times such as during illnesses, colds, or fighting a disease such as cancer.